Hi, my name is Don. I'm a student at CF, part of the ADN program. Today's video will be on tracheostomy suctioning. And I have a doctor's order, which is required for tracheostomy suctioning. The doctor has requested each 2 hours in PRN at 120 PSI. So we have portable suction available. And I've gathered a few other supplies. I have a tracheostomy kit, I have a drape. You can see that I'm wearing PPE myself to try to prevent any secretions from getting on my scrubs. I have an ambu bag, which would provide 100% oxygen. I will hyperventilate the patient before and after the procedure. I have a normal saline unopened, which after I open it and use it for this procedure, then I would date and initial it. So I'll go ahead and from the beginning, I've knocked on the door. I've introduced myself to the patient. I'm going to confirm and verify the patient's identification, which he's capable of nodding. First name, Joe, last name, Smythe, and his date of birth. I've also checked his medical record number. I've raised the I've raised the bed up for proper body mechanics to a comfortable working position, and I've provided patient privacy. So, in this procedure, I'm going to use a drape over the patient's clothes to protect his clothing from any possible secretions. And although I have my PPE on, I'm not going to wear, for the purpose of this video, the mask or the face shield myself. I want to establish a distress signal, and in explaining the procedure to the patient, he indicates that he has had this done frequently and he is familiar with the procedure. Our distress signal will be for Mr. Smythe to raise his left hand if at any point in the procedure he needs us to take a break, or if he's in a little bit of respiratory distress, we can hyperventilate him with the ambu bag. Okay, thank you, Mr. Smythe. We'll begin. In my lung assessment, I want to make sure not to have any barrier between the patient's skin and my stethoscope. And I would do a thorough lung assessment on the anterior and posterior of the patient. I also have pulse oximetry available, so I can monitor that. I can see that he's at 91% on his pulse oximetry. Throughout the procedure, I'll be monitoring that. And if that drops, we would stop the procedure or hyperventilate the patient, make whatever means necessary. I can also ask the patient to roll so I can listen to the posterior of his lung sounds. In opening up my sterile tracheostomy kit, I want to pour my normal saline. Okay, so with sterile gloves in place, I'm going to go ahead and find my tracheostomy suctioning tube. Now, I'm willing to lose my left sterile hand to hyperventilate the patient and to connect to suction. Suction's turned on. I see that it's regulated at 120 psi. So I'll connect the suction tube, and careful not to let the end of this suction be contaminated. I will go ahead and test the suction in here, and this will also lubricate in the water. Suction works well. Okay. I'll move the oxygen from the patient, hyperventilate the patient, working with the patient's respiration. So I want to give 3 to 5 Ambu assisted respirations. Okay, I see that the pulse ox has gone up to 94, but there are still tracheal secretions. I'll begin to advance the catheter without suction until I meet resistance. On meeting resistance, I'll begin to pull back, withdraw the suction tubing, and at 1 centimeter intervals, I will provide mild suction lasting no longer than a total of 10 to 15 seconds. I will then clean the tubing. Mr. Smythe, you're doing okay? Nods. I can provide Ambu respirations. There's still some secretions here, so we're going to advance the suction again till we meet resistance. Drawing it slowly, 1 centimeter at a time, providing a light suction. Now, it's important to note that I should wait 1 minute between suctioning, and that's really to keep the patient from becoming hypoxic and giving them time to recover from a respiratory distress. Now, throughout this, though, his pulse oximetry is up to 94, floating to 95. Okay. At this point, I can discard the suction tubing. I want to do a complete lung assessment again on the patient. Mr. Smythe, you feeling okay? I'll listen again to the anterior and posterior of the lungs. I can tell that he's breathing much more clearly now without the congestion, and that his pulse ox is up to 96 at this point. So that's the end of the suctioning portion. I will lower the bed. I want to document on the patient, and I can provide his pillow bag for him. And make sure to keep his call button in reach. Thank you, Mr. Smythe.